Hello, this is Mitchell Gossman, ophthalmologist in St. Cloud, Minnesota. I'm going to demonstrate the use of the Beaver Visitech eye-ring pupil expansion device. I'm deliberately recording my very first use of it, actually, used after studying videos of others and its design. I've been using the Malyugin ring for a long time. Here the inserter is placed through the main corneal incision after filling the anterior chamber with viscoat. And the first thing I notice is there's a fair amount of resistance, and the plunger extends the device in little jumps. So you'll see here a pretty big jump as I'm applying pressure, more and more pressure, and then all of a sudden, boom, the extender, the hook comes out all at once. I learned immediately that the best way to unhook it is to turn it to the side and then be sure to retract it before pulling from the incision so you don't catch the anterior lip. So there it is sitting on top of the iris. I did place a little more viscoelastic in before. This is an ordinary Sinskey hook. Placing the distal channel, as they're called, onto the sphincter. Applying downward pressure to engage the sphincter between the two sides of the channel. And the Sinskey comes right out. Now the proximal channel. Now you can see that the downward pressure needed to catch the opening is catching the iris, so I inserted the tip of the Sinskey into the hole, the positioning hole, right here, and gave it a little turn so that it's catching the sides of the hole, so I can lift it upward and then down onto the sphincter. And then I turn it straight up again so it pops out, and then repeat. As I view this, it feels slow, and I guess it was slow, being the first time. You notice that the pupil was moderately dilated. This patient is a Flomax user, and immediately on irrigating the anterior chamber with epi sugarcane, I noticed floppy iris. I was planning on using a pupil expansion ring anyway due to the history of being poorly dilated in the office. Cataract surgery is done. There's the intraocular lens in the bag. Disengaging the distal channel again is accomplished by pulling, turning so that the Sinskey hook is tighter inside the positioning hole, and then lift and drop it onto the iris surface. Fourth time is the charm. Pushing it into the angle so I can access the proximal channel easier. During phaco, I noticed that the proximal channel is thicker, much thicker than the Malyugin ring, so next time I'll be sliding that proximal channel to the left so that there's less thickness getting in the way of my phaco tip. This is the critical one. You'd hate to disengage from the iris sphincter and have it drop into the sulcus. Having some difficulty getting enough upward lift force with just the Sinskey and the positioning hole, so I getting a second instrument. To lift it upward and engage it onto the platform of the inserter. And at this point the ring had rotated counterclockwise a little bit, so it's best to have that hook wrap around the thinner portion of the channel just to the right of the proximal channel. There's a little thinner area there they call the hinge. Instead I used a second instrument to lift it onto the platform and grasp it in the thicker portion, which worked just fine. And again, it takes quite a bit of force to move this device through the channel, so it goes in spurts. Probably with experience it gets to be smoother, the operation of the plunger. Viscoelastic removal. You'll see some floppy iris and then meiosis. It's difficult to see from the two-dimensional view, but the proximal subincisional iris is coming forward trying to plug the incision. So I asked for some Myocol E. Quite a bit of billowing taking place now. And with the irrigation handpiece still in the eye, I'm placing some Myocol E into the anterior chamber to constrict the pupil and pull it away from the interior of the clear cornea incision before withdrawing the irrigation aspiration handpiece. Hydrating the supraincisional pocket, the so-called Wong pocket that I placed to compress the clear cornea incision and seal it. And pressurizing the eye first through the paracentesis. And I place a little tiny supraincisional pocket over the paracentesis with the same 1mm Accutome diamond blade. And we'll hydrate that too. Checking the incision integrity for water tightness. And we're done. Thank you for your attention.